Again for joining us for this call. Again, my name is Javier Salazar, and I'm the Senior Director of Programs here at Health HIV, as well as the Project Director for the AETC NC as we call it. I'd also like to welcome you and thank you for your interest in the call and in the AETC. The purpose of today's call is to offer health centers the opportunity to gain further information on and inquire about our current capacity building opportunity, or as we call it, the HIV and Primary Care Learning Community, and in this instance, the 2012 HIV and Primary Care Learning Community. In addition to Victor, I'm also joined today by our Program Manager, Christine Stewart. I'd like to begin by reviewing our web conference agenda. It includes an overview of several topics related to our project, the application and selection process. We'll review the AETC. We'll just provide an overview of the HIV and Primary Care Learning Community. We'll discuss how health centers are selected, the application. We'll provide an overview of the application itself and offer some time at the end for any questions that you may have. About the AETC. The AETC is the Health Resources and Services Administration's HIV/AIDS Bureau's major effort to reach beyond its grantees, the Ryan White funded community, and address the evolving needs and nature of HIV care and treatment within highly impacted communities of color. The AETC is funded through the Minority AIDS Initiative and the AIDS Education and Training Center program. It's specifically focused on expanding the organizational capacity of federally qualified health centers and lookalikes to provide care and treatment to people living with HIV. The AETC supports the President's National HIV/AIDS strategy in reducing HIV-related health disparities by expanding HIV care and treatment capacity at the community level and by facilitating linkages. The AETC provides comprehensive organizational capacity building in addition to clinical training on HIV care and treatment for up to 25 health centers annually. The selected health centers will undergo an intensive practice redesign to develop, expand, or improve organization-wide systems, practice processes, and outcomes to build sustainable HIV programs. About the HIV and Primary Care Learning Community. A learning community is an established model that brings together multiple stakeholders around a common purpose and provides training, capacity building, and coaching while also sharing knowledge across organizations. By facilitating shared knowledge across organizations, the learning community generates new ideas and innovations, improves measurement of common health status indicators, and ultimately works to ensure the delivery of quality HIV care. The purpose of the HIV and Primary Care Learning Community is to increase access to comprehensive HIV primary care for racial and ethnic minority communities who are severely impacted by HIV by developing the organizational capacity of health centers that are not directly funded through the Ryan White program. The diagram you see here visually depicts the learning community curriculum, which is designed around the patient-centered medical home model and practice redesign. We won't go into too much detail here, but we want to show you that it's built to support the integration of HIV into primary care practices, while also providing clinical support for the expansion of HIV care and treatment. If your health center is selected, we will present the curriculum in detail to you as a group. The capacity building package offered to each health center will include technical assistance in a variety of areas, including HIV clinical care within primary care, patient-centered medical home with HIV as a population of focus, care coordination, partnership development, practice and system redesign or patient flow, maximizing revenue for HIV services, and building the business case. The curriculum will be delivered through self-paced learning, tailored on-site technical assistance, and utilizing distance technologies. In addition to our standard curriculum, we will offer health centers a few resources to supplement the capacity building. These include clinical mentors to support clinical learning, performance improvement coaches to provide guidance during and through the transformation process, and twinning with Ryan White Part C clinics in their region to increase sustainability of clinical TA offered through the center and through our sister regional AETCs. To support health centers in the learning community over time, we've created a virtual learning lab. This slide is a screen capture of the lab, which is a restricted access web portal to provide a safe space for staff of health centers to engage in shared learning. It includes discussion boards, live and archived webcasts, discussions facilitated by AETC, NC, HCMC clinical and program faculty, and a resource library. And now Christine will go into the benefits of participation.
Thank you, Javier. So expansion and access to healthcare services beginning in 2013 could mean an increase in patients for health centers, including those living with HIV. Participation in this program can help your organization be proactive and prepared to provide care and treatments to people living with HIV. Thoughtfully expand services in a sustainable manner. Learn how to maximize revenue to cover costs for the addition of HIV services, and connect to state and local networks to help support the program. We realize that these changes cannot be implemented successfully solely by transferring knowledge to the clinical staff. We believe that for change to be successful, we must enact changes throughout the entire organization. As Hav mentioned earlier, we do this through practice redesign based on patient-centered medical home framework. Federal regulations will require community health centers to become recognized medical homes in the next few years, so this project aligns with transformation activities your organization may currently be involved in or may soon engage in. While HIV is the population of focus in this project, the assistance you gain is broadly applicable and supports the entire organization. All of this will be supported by access to expert faculty, many live and archived webinars, and face-to-face workshops and targeted technical assistance. So the next thing we want to discuss are the responsibilities for the health centers that participate in this project. We want all of the organizations to be able to commit to a one-year time commitment, commit to develop or expand HIV services, and have the participation that's supported through the CEO. The CEO's role is to remove barriers for staff implementing changes and allow time for access learning resources, and they're willing to restructure the systems. We also want our organizations to appoint 2 learning leaders, one that will lead the practice transformation and the other to coordinate the learning needs of the clinical staff involved in this project. These leaders should be senior staff that have the power to enact change within your organization. We also want change that's supported organization-wide and not solely through one department or unit like the HIV department. The completion of organizational assessments as well as individual clinical assessments for providers participating in the project is also one of our expectations. We also will want to have site visits at some of your health centers. There will be approximately half a day where the members of the learning community team may come on site to your health center to meet with learning leaders, the CEO, and other key staff involved in the project. We also expect regular communication from your health center with AETC and HCMC staff and their performance improvement coaches, including reporting. To be eligible for participation in the HIV and primary care learning community, organizations must be federally qualified health centers or health center lookalikes that are not directly funded by the Ryan White HIV/AIDS program and have a 4-year history of providing primary medical care within racial and ethnic minority communities. In the past, we've received questions about receipt of Ryan White dollars, and we'd like to stress that subcontractors are eligible. Just as long as the health center is not the direct HAB grantee, they are eligible for this project. We're also looking for health centers that can manage an intensive practice redesign process in order to expand primary care to include HIV care and treatment, and have identified characteristics that may demonstrate that a health center is prepared to succeed in the HIV and primary care learning community. These characteristics include a demonstrated commitment and intent to deliver HIV care and treatment services, having senior leadership in place for at least 3 years, the capacity to manage HIV patients and the ability to report outcomes through EHRs and practice management systems, and dedicated quality improvement staff persons. Participating health centers should also be located in or near a community whose residents are at risk for or living with HIV and are predominantly racial and ethnic minorities. Preference will be given to organizations located in a geographic area with a high burden of HIV disease with relatively low resources. Additionally, the HIV/AIDS Bureau, the funder of this program, has requested that the AETC NCHCMC give particular emphasis to recruiting health centers in the 12 high-burden areas identified by the CDC. Those cities are listed on this page. But while we're charged with focusing on the 12 cities that you saw on that previous slide, we are recruiting organizations across the entire United States and U.S. territories. We're interested in health centers that reach vulnerable populations like migrant workers, the homeless, transgendered individuals, and youth as part of this project. If you have additional questions about eligibility, please visit our project website, www.nchcmc.org. Interested health organizations will need to complete an application exploring capacity and infrastructure to provide HIV care. The application will be available in 2 formats, a web-based version and a Word document fill-in form. We request that it be returned, if you're completing the Word form, we request it be returned in Word format by email, but fax is also acceptable if you are unable to email the completed application. The application is also available in Spanish and will be posted to our website next week. Again, the application can be accessed by visiting www.nchcmc.org. So we've tried to make the application simple to complete, but we'd like to share a few notes about filling out the application. You will need your 2010 UDS data for Section 1. Questions requiring a narrative response are limited to 75 words in the response field unless otherwise noted, so please keep that in mind when phrasing your answers. And a signed letter of support from your board chair is required to complete your application package. Each applicant will be reviewed by an external review panel representing both primary care and HIV expertise and experience. Well, they'll recommend up to 25 health centers for participation, and selected health centers will be notified by January 1st, 2012. The next thing is just some key dates I want to make sure that you all recognize. The application, again, is due November 18th. Health centers will be notified on the 1st of January. We'll likely begin practice assessments on January 5th, 2012, but that will go, we'll have to schedule that with each of your health centers, so that will go for about another month after that. And there'll also be a community meeting where we're bringing together all of the health centers in the spring. They'll all come here to Washington, D.C., expenses paid for by the project in spring 2012. The end of the one-year commitment is December 2012. And we'd also like to point out that we will continue to support your organization through August 2013.
Thank you, Christine and Javier. At this time, we'll unmute all phone lines for questions, but request that if you would like to ask a question of the presenters, please either click the raise hand button so we may call on you, or the chat button and type your question to the presenters. All chat questions will be read aloud to participants and answered for all to hear. If you do raise your hand and have been called on, please lower your hand by clicking the icon a second time. All lines are now unmuted. And we have an email question coming in. The person asks, what is the time commitment expected of CEOs and CFOs? Christine?
Well, CFOs are not necessarily directly involved, but for the CEO, the one main thing that we will expect them to do is participate in our first face-to-face meeting. We also expect that the CEO is involved in being able to remove barriers, and we have a few calls where the CEO will be required to participate on, but we really will be limiting the time commitment and the pull on the CEO, understanding that there are a lot of other activities that person will have. I would say a maximum of 1 hour a month for that CEO.
Thank you, and I hope that answers your question. We have another chat question coming in. Does this program provide any funding to the health center? Javier or Christine?
There is no direct funding, but we will support, we do have some financial assistance through the way of being able to provide financial assistance to attend conferences that are directly related to the HIV curriculum and the learning that we will be providing. So those funds will come through a discussion with your staff contact here at the AETC, but they're not direct funds, no.
One thing I would like to add is that we will be providing expert faculty, training opportunities, technical assistance, and related support. All of this will be made available to improve, for example, your billing systems and revenue options.
Thank you, and I hope that answers your question. We have another question coming in. This writer asks, would this project be appropriate for clinics who already have HIV programs running? How would it be helpful? Javier?
I think that the answer is yes, but of course it all depends on the extent. If you're fully integrated, then you potentially have already reached the goal of this project in terms of fully integrating HIV care and treatment into the primary care setting. If you are seeking to enhance your capacity, for example, you are referring out, for example, and need to improve that and potentially move to fully integrating, we can be helpful. So there are multiple ways. Christine and our other program manager are available to discuss your situation individually if you would like to call or would like them to reach out to you specifically. The last thing I would add is that we encourage, at Health HIV, we have, in addition to the AETC project, we have multiple other opportunities for organizations that are seeking to increase their capabilities around the provision of HIV care, either the clinical capabilities or their organizational ones. So either way, we'd like to have you either reach out to us or have us reach out to you so that we can engage you in these other opportunities that we have.
Thank you, Javier. While we wait for other questions to come in, I would like to point out that due to the high level of interest demonstrated by health centers in this opportunity, we will be hosting 4 more conference calls over the following week. On Friday the 21st, today, at 1 p.m. Eastern Daylight Time, there will be a second call, a third scheduled for 3 p.m. Eastern today, a call on Tuesday the 25th at 1 p.m. Eastern, and Wednesday the 26th at 4 p.m. Eastern. So if you, one of your colleagues, or someone within your network is interested in learning more about this opportunity, we encourage you to visit the NCHC website and register for any of these future dates. Not seeing any other questions? Thank you all for participating on today's web conference. If you have questions about this opportunity or know of someone in your health center who would be interested in learning more about this program, please contact contact Brad Ward or Christine Stewart. Their information is listed here for your convenience. Thank you all for your participation and have a wonderful day.